Hello, and welcome to our series Connect and Educate. This is a series which requires a lot of partnerships, and we are extremely pleased to have a partnership with the North American Council on Adoptable Children to provide two very informative sessions. This is one of them today that I know many of you will find extremely helpful. And you will also learn about how to get more education from the North American Council on Adoptable Children from Barb as she goes through her presentation. And Barb, thank you so very much for agreeing to do this with us and for our families here in Virginia.
My pleasure. Always excited to share this info.
Great. Barb is one of the national experts that does training on the fetal alcohol spectrum disorders. So we are very privileged that she would be able to find some time to do this with us today. And it is a primer. And I do want to allow Barb to introduce her role at NACAC, that's how we call the North American Council on Adoptable Children, and as well as kind of her learning objective or goals for this session today. And thank you, Barb. I'm going to take myself out of the picture and turn it over to you.
All right, thanks, Kate. Yeah, my name is Barb Clark. I'm coming to you guys from the Minneapolis, Minnesota area. That's where our NACAC's headquarters are here, but we do have some staff kind of dispersed throughout the country. I am our parent support and training specialist, and I am an adoptive parent. I've got 4 young adult children, one of which is diagnosed with a fetal alcohol spectrum disorder. And so that's one of the reasons why I'm super passionate about spreading more awareness and information and resources and strategies and all that kind of stuff on FASD. And so, yeah, as Kate was saying, today we're only here for about an hour or so. And that's not enough time. You'll see, I hope I don't start talking too fast. Sometimes I've been called the Jimmy John of child welfare because I get talking real fast when I'm running out of time and I have so much to share. So anyways, with that, I'm going to get started. This is just a primer today. Just really quick, though, a little bit. Many of you maybe have not heard of NACAC, the North American Council on Adoptable Children. We've been around since the early 70s. And we do a lot of advocacy around child welfare, around foster, adoptive, kinship, kind of legislative things or stuff like that. We do support. What we mostly do is we provide training for agencies, organizations, individuals to provide post-adoption or post-placement support in their communities. In Minnesota, we do actually have a department that does provide some, person-to-person support for families in Minnesota. But we also have a staff person, Josh Kroll, who works on adoption assistance and tax credit support for families in all of the states and territories and provinces. Well, not provinces, we're in the US here today, right? We work in Canada also. But we also try to just we do get a lot of phone calls from families from around the country with questions. Sometimes they're struggling. What we try to do is we try to connect with them with local support in their communities. And so we do a lot of different training, though. That's something we're very passionate about. It's my kind of passion, one of my passions, just training on child welfare kind of policies, regulations, things like that, but also on best practices when it comes to dealing with kids who have trauma histories or fetal alcohol or other things like that. We do a lot of training also for parents on how to lead support groups and peer-to-peer support for each other, because if many of you guys out there who are adoptive, foster, or kinship parents have maybe experienced, you've worked with a lot of awesome professionals and who give you some great advice and support. But what I can tell you from my own experience and from the tons of people I've worked with around the country is that the most effective support and help is usually from other parents who have lived experience. And so we're passionate about that. So with that, I'm going to jump into my presentation here. So what I try to frame fetal alcohol spectrum disorders within a trauma lens. So Dr. Bruce Perry is kind of the leading expert on childhood trauma internationally. And he puts he puts them into kind of 3 categories. He talks about intrauterine insults. So this is when the child isn't even born yet, when they're a fetus. And this means that they could be the different types of trauma they can experience in utero. I mean, it could be that mom is in a car accident or has other kind of things like that going on. But it also could be drug and or alcohol exposure in utero. That is trauma. A fetus being exposed to toxic substances is a form of in utero trauma. But also even just a mom who has really high levels of stress, right? Could be from a multitude of reasons that she's experiencing stress. And clearly any pregnant woman is going to experience stress. But if it's toxic, consistent stress throughout the pregnancy, we know that we have cortisol going through our body when we're stressed. And that for significant portions of the pregnancy, that cortisol can actually have an impact on the developing fetus and on their brain in particular. And then the second kind of category of trauma is the early years, right? The early neglect or separation even. And so we know that children who are in adoptive, foster, or kinship situations, just not being with their biological first family in and of itself is a form of trauma. That does not mean that every child in a situation like that is going to have significant lifelong struggles, but it does mean that we as parents and caregivers and support systems need to acknowledge the identity and the loss that there is within that, in those kind of placements for the children. But it also could just be that a child that did not receive the right kind of nurturing in those early years of life, right? We know through a lot of early childhood development how important attention, attunement, nurturing in those early years in particular is for a developing fetus. There could be a multitude of reasons why they didn't receive that in the early years. It could be a mom who was dealing with postpartum depression and or other mental health issues. Could be somebody struggling with addiction, domestic violence, children who are in an orphanage. I hear all the time, I think about a month ago, I had a family telling me while I was doing a training that they had just been in Haiti at an orphanage and went into the infant room. And I've heard this for tons of years from, people that have gone to some of the, international adoptions and the orphanages, and they'll go into the infant room and there'll be like dozens of cribs with dozens of babies and nobody's crying. None of the babies cry. It's kind of eerie to hear how quiet it is. And what happens is an infant realizes if nobody comes to them when they cry to figure out if they're hungry, if they're soiled, if they're in pain, what's going on, if nobody comes to them, eventually they stop crying. And that has a significant impact on their brain development in those early, in that first year in particular. So that's kind of the second, type of category of trauma that our kids can experience, is just not getting the right attention or nurturing in those early years. And then we've got kind of the classic trauma. Most of us, when we hear the word trauma, we think of a child experiencing or witnessing abuse, whether it's physical, emotional, sexual. There's other types of trauma too. We've got natural disasters, car accidents, other kind of traumatic things that can happen. So those kind of fit in that third category. Well, what we are seeing with a lot of our children who are in adoptive, foster, or kinship placements is that many of them all of them pretty much have experienced at least one of these categories, right? And many of them have experienced two of these categories, and many of them, unfortunately, have experienced all three of them as well. And so that can have a significant impact on their developing brain, which can play out in a lot of different kind of unique and often quirky kind of ways. So we're going to talk about that here coming up. I do get asked often, what's more damaging to a developing fetus, alcohol or drugs? And clearly the answer is both. We don't want our kids exposed to either, right? Any substances. But the Institute on Medicine has deemed that of all substances of abuse, that alcohol produces by far the most severe impact to a developing fetus. So the drugs are still not good, right? This chart here kind of shows a little bit of the varying impacts that some of the different drugs can have on a developing fetus. But what you can see there under the the column that has alcohol in it, the impact is just more severe. And so, but one of the challenges that we see with a lot of our kids in child welfare is that if they were exposed to illicit street drugs, they were also likely exposed to alcohol. many reasons why we usually often will see that there is confirmation of the drug exposure, excuse me. We'll see confirmation of that will be in their case files often, but the alcohol won't. And there's several reasons for that. One is that there's kind of this misinformation out there that the drugs is more damaging, and so they're more likely to get that info documented. But one of the big reasons is because alcohol doesn't stay in the system as long as the drugs do. And so in the hospital at birth, if there's red flags and they did testing for exposures, they can show by tests the exposures to the drugs, but not really the alcohol, because it doesn't stay in the system long enough. And the other thing is that with the alcohol exposure, our children don't go through withdrawal usually from just alcohol exposure. That's usually a sign that there was drug exposure as well. So just important things to know. So in '96, they made this a spectrum disorder. So it's a set of physical, behavioral, and cognitive disorders that can affect people who were prenatally exposed. Everybody that is exposed is impacted differently. And that's just really important to know. I'll have people say to me all the time, well, I drank when I was pregnant and my kids are adults and they're doing fine. Or they'll say, my mom drank when she was pregnant with me and I'm fine. And I always say, I'm super glad everybody's fine, but it might have taken potential away that we're not even aware of, right? And my mom actually drank when she was pregnant with me back in the 60s. And before, they used to tell women to drink when they were pregnant to help calm the nerves, to help the baby drop. They used to put, if you went into premature labor back then and went to the hospital, they would often put women on an alcohol drip on an IV to stop the contractions. And so I've worked with a couple of families here in Minnesota who their kids were diagnosed when they were almost 40 with FASD and had significant struggles their entire life, but nobody ever figured out why. It was just misdiagnosed as some different mental health issues. And then they finally figured that out. So imagine how many thousands of adults are walking around in this world with FASD who are misdiagnosed with other things. So yeah, I think it has an impact. I do think it impacted me. I'm horrible at math. I changed my major in college 3 times to avoid math. I struggle with the brain function of crossing the midline. I can't figure out how to knit or crochet. I don't like to do a lot of crafty things, and maybe that's why. But but I've been able to function somewhat okay in society still. But there's just little things where I do think it probably had an impact. The most important thing, though, that I'm always trying to get families and professionals to know is that FASDs are permanent disabilities that result in a lifetime of brain injury or brain damage. Some people prefer to say brain injury, and some prefer to say brain damage. That doesn't mean that our kids who have this can't do better and won't do better. It just means that in those especially in the earlier years is when it can get kind of hard for a while. And we'll talk a little bit about that coming up, but there is hope. There's always hope with any kind of disability. And the most important thing is for the families, for us to start doing things differently while we try to help their brain develop and do better. So these are the main diagnoses that we see underneath the umbrella. Again, it's a spectrum disorder. So you don't get diagnosed with fetal alcohol spectrum disorder. That's an overall category, and there's several diagnoses under it. Fetal alcohol syndrome is one of those. That's the one most of us have heard of. For that one, those kids have 3 different facial features that they have to have. They have to have growth deficits below the 10th percentile, and then they have to meet the cognitive profile. This really quickly is a picture of the face of FAS. So they have to have a smooth philtrum. The philtrum is this little ridge that we have here between our nose and our upper lip. So a smooth philtrum, a thin upper lip, and then short palpebral fissures, which just means small eye openings. So that's the face of FAS, and you might hear that term all the time referred to. That's fetal alcohol syndrome. It is more likely for kids with FAS to have a lower IQ, but there are definitely many, many, many kids and adults who have fetal alcohol syndrome who have average IQs even. So it's not always a given. Partial fetal alcohol syndrome just means they only have some of the facial features, but don't have them all. But the more common one there is the alcohol-related neurodevelopmental disorder, ARND. That used to be called fetal alcohol effect, but in 1996, they changed that term to ARND. So those are kids that receive the brain injury from the exposure, but do not have any of the outward physical features. And so that's truly the invisible one that's on there. So those three diagnoses are medical diagnoses that a medical doctor can diagnose. Now in the DSM-5, which that's the Diagnostic Statistical Manual that mental health professionals use for diagnostics, in 2013, they put in the back of the book for further research something called neurodevelopmental disorder associated with prenatal alcohol exposure. So we are seeing that being used in some areas around the country, and actually in Virginia, it's more common to be used. In Minnesota, it's not being used at all. Just those top 3 ones are. So any of these diagnoses on here are under the fetal alcohol umbrella. And the important thing to know is that all of these diagnoses can have a varying level of severity or mildness in how it impacts the child, right? So it's not better to have a diagnosis of fetal alcohol syndrome as opposed to alcohol-related neurodevelopmental disorder, or whichever ones you want to pick and choose, right? They can all have varying levels of impacts. And so it's not a spectrum on how difficult or not it is. People will say to me, well, my kid didn't get the full diagnosis. And I'm like, well, stop. What do you mean by that? And then they'll say sometimes that, oh, well, they were diagnosed with ARND or the NDPAE. And I'm like, no, that is totally a full diagnosis. That is a diagnosis showing that their brain was impacted by the exposure. And so it is a full diagnosis still. But a really important thing to know, and this is something, oops, I missed a percentage sign in there. Only 10% that should say, not 10, only 10 of the people should say only 10% of people on the fetal alcohol spectrum have the facial features. So the face is actually quite rare. There's only 3 days during pregnancy, and it's days like 19, 20, and 21 or so when those facial features are formed. But I know women, I used to work at an organization called Proof Alliance. They formerly were called the Minnesota Organization on Fetal Alcohol Syndrome. But I worked with many women there, many adoptive families, many biological families, different families. And I had women who told me, oh no, I for sure drank on those days, and their kids don't have the facial features. So they still don't know exactly why some of the kids get that. But what you guys might encounter out there is there's a lot of misinformation within the medical community in particular about fetal alcohol. They will use the face as a screening tool for fetal alcohol, and that is a bummer. That is not acceptable because, again, only 10% of the kids have the facial features. And so a lot of times the families that I work with around the country are having to be the ones to educate their medical professionals on this, unfortunately. And often in the mental health or education or social service fields, that is still kind of some misinformation that's out there. So I just want you to be aware of that. Factors that impact the degree of brain injury to the developing fetus, right? And so why are some kids more impacted and, you know, some are less impacted by the exposure? One is timing of exposure. I've worked with a family, I've known a family for years now. Their son is about 18 or 19, and the mom was a college student here in Minnesota, partying like many college students do, doing a lot of binge drinking, and all of a sudden had a 10-week unplanned pregnancy. She immediately stopped drinking, went to the OBGYN, and they said, well, stop drinking, you know, and they sent her to a genetic doctor for testing while she was pregnant. And everything looked fine. Her son was born very healthy, typical development, high APGAR scores at birth, developed the way he should in all of those initial pediatric appointments. But as he was getting into his toddler and preschool and school age years, had really tough behaviors. And so, but all along, they started doing different therapies, interventions, intake sessions in tons of different clinics, like many of us have done. And she kept saying, you know, he was diagnosed with ADHD and also oppositional defiant disorder, eventually conduct disorder. And he would have, if he was in an adoptive foster or kinship family, he would have been diagnosed with reactive attachment disorder. Absolutely, in my 100% in my mind, he would have had the RAD diagnosis. And that I don't know if everybody knows this, but the experts in attachment are saying that that diagnosis is way overused, and that what's happening is that when we have kids with explosive behaviors who are in adoptive, foster, or kinship situations, that the RAD diagnosis is thrown on there because they can't figure stuff out, you know, what else it is. And a lot of times it's underlying brain issues from exposure in utero. But anyways, when he was about 8 or 9, she finally got to a provider for an intake session who, when she said she drank the first 10 weeks, this doctor was like, oh, okay, let's send you to an FASD diagnostic clinic and look into this. For years, all the different providers kept saying, oh, nope, he doesn't have the face, and never sent her for a diagnostic kind of, you know, searching in that area. And so he was diagnosed immediately. That was when I met her. The bummer on there is we've just missed 8 or 9 years of using the appropriate interventions based on the way that his brain works. Because he has an average or high IQ, we just keep using the same type of interventions and therapies and strategies within the family, school, and community. And all that did was cause more behaviors and issues. So the diagnosis, the earlier the diagnosis, the better. But it's not safe to use alcohol during any of the trimesters. The third trimester is actually when the cognitive damage happens to the fetus, to their brain. So that's where we see kids that have the lower IQs and stuff like that, that generally is the sign that there was exposure in that third trimester of pregnancy. Resiliency of the fetus is another factor that goes into it. So in this next slide here, showing some research when they looked at twins and twins who were exposed in utero to alcohol. And what they found was that twins who were exposed, who were identical, had pretty similar impacts, but fraternal twins who did not share the same kind of genetic makeup were vastly different in how they were impacted by the exposure. So that shows us that resiliency and the individual immune system also plays into this. Metabolism and diet of the mother is important too, right? We could have 2 women the same age, the same weight, who drink an alcoholic beverage at the same rate, the same time period, and they're going to have different blood alcohol levels because we all metabolize alcohol differently. And definitely for the mom and the developing fetus, that is very true. And the way that pregnancy works is that the amniotic fluid kind of acts as a reservoir, and so it stores up food so that the fetus can be fed, you know, in between when mom is eating even or drinking. And so the alcohol actually is sitting in the amniotic fluid as a reservoir. So what's happening is our fetuses are exposed to the alcohol for even longer periods of time than the mom was. And then the blood alcohol concentration of the mother is the other thing. So there are still doctors and experts and people who say it's okay to drink mildly or lightly or moderately through pregnancy. And I'm telling you what, they are wrong. Please spread that message. It is just not safe or worth the risk to take potential away from any child. So getting that information out there that it isn't safe and okay to do is a really good idea. But even those people will say that the binge drinking or higher level of drinking is not safe. Prevalence. So in 2018, they did research. Some new research came out showing that about 1 out of 20 children have an FASD. They went to 4 communities around our country. They went to small towns, middle-sized towns, suburban, inner city, diverse. They found that 1 out of 20 kids should be diagnosed with this. But of the 6,000 some that they diagnosed, only 1 actually was. And so this diagnosis is usually missed. In foster care and adoption, some research has shown that it's 10 times higher than it is in the general population. So this is something that is hitting our families at really high rates, but again, it's almost always being misdiagnosed as something else. So this is twice as common as autism. And most of us have heard a pretty significant amount about autism, but usually very little about fetal alcohol. And our schools are much more competent and savvy about autism nowadays, but very few schools have any comprehension on FASD, unfortunately. A tough fact is that children with an FASD are 3 times more likely to be abused or neglected than typically developing children. So that's why we're also seeing higher rates of them going into foster care and into the child welfare system, because some of their behaviors are so incredibly challenging that if somebody is living an at-risk lifestyle or struggling with addiction or other economic factors, parenting a really high needs child, is really stressful for people who are not struggling financially or with addiction. Or like I always say this, like, geez, I can't even imagine how we would have parented our daughter if we didn't have some of the education and if we weren't financially stable and didn't have a great support network. I already almost lost my mind and went over the edge and to the brink of insanity, right? I can't even imagine how somebody else that had other kind of significant struggles or mental health issues would be able to do this. And so that's just something to be aware of. Here's some red flags for it too. If we have a child in a foster, adoptive, or kinship situation, that's a red flag. FASD United is the new name for the National Organization on Fetal Alcohol Syndrome. They just named themselves that last week, so this is brand new. They have estimated that 70 to 80% of children going into foster care were prenatally exposed to alcohol. We're seeing really high rates of this in a lot of international adoptions, a lot of the Eastern European Bloc countries, Russia, Kazakhstan, Romania, Ukraine, seeing high rates of it. Korea has the highest rate of alcohol consumption per capita in the world. So that's a red flag. If we know there's chemical dependency issues for the adolescent or their biological family, that's a red flag. Some of those classic ADHD kind of behaviors and stuff, that's a red flag too. There's some differences. Two of the things that the researchers have said that are usually different for fetal alcohol is that our kids are more likely to be consistent rule breakers, and they're also more likely to be verbally and or physically explosive than just straight ADHD. Doesn't mean kids with ADHD don't struggle with those, but it's more common for our population. But if we have two kids, if we have Joe over here who struggles with ADHD, and we have Jaquan here who struggles with FASD. And let's say we know that both of them struggle to pay attention, right? And so we do a sensory activity, or maybe we have them on meds, whatever it is, we do something with them, have them jump on the trampoline before we have them sit down to do their 10 minutes of homework at a time, right? We know we can't go more than 5 or 10 minutes at a time. And they both are able to sit and focus and pay attention for that time. And they both comprehend it. And then maybe an hour later or a day later or whatever point, then we're asking them both about whatever we were working on in those 10 minutes. And what's really common is that a child who has just straight ADHD is more than likely going to be able to answer and have retained that information. Whereas a kid with an FASD might look at you like, what are you talking about? Like you've never talked about this before, or they just can't remember or something like that. And so that's a really common thing. Sometimes for our kids, it's that they remembered it, but they couldn't get to the info when we needed them to in the moment. And sometimes it just didn't stick in their memory. And so then this bottom thing here, though, if we have a child who continues to make, or adolescent, the same mistakes over and over, and they're not learning from the consequences, and they've been in a stable environment for at least 6 to 12 months, right? Because it takes a while. It takes a while for our kids to actually feel safe and to get to know the new routine and that kind of stuff if they're new in a family setting. But if they're not learning from consequences and keep doing the same thing over and over, that's a neuro disconnect. It is not neurotypical to not learn from a consequence and to keep making the same mistakes over and over. So it doesn't always mean FASD, right? It could be some other kind of neurodiversity that's going on, but that is one of the classic hallmark symptoms of fetal alcohol, is not learning from mistakes and consequences. Then a few other red flags, a lot of diagnoses. My daughter has over 25 diagnoses on her diagnostic list. A lot of them are medical things. It's really common for our kids to have some different medical stuff, especially as they're getting older. They might not have it when they're younger even, but when they're getting older, we can see some different medical things. It can be hearing or vision, but it can also be some rheumatoid things or congenital heart defects or stuff like that. But again, our kids, and sometimes our kids have co-occurring ADHD or autism or ODD or whatever it is. But a lot of times, some of those mental health things are just the misdiagnoses, because FASD can look like so many of those other things. If we have a child or adolescent who consistently displays some of the extreme behaviors, the emotional dysregulation, verbal and or physical explosiveness, that's a red flag. Sleeping and eating issues. Again, we know a lot of times with our kids, depending on their history of trauma and neglect, they might have issues with that. But that family I was talking about where the mom used when she was a college student for the first 10 weeks, her son has significant sleeping and eating issues. And she got married, had 2 other children who were not prenatally exposed, wonderful, loving family. And he is a hot mess. He is a senior in high school right now, and he really, really struggles. And so, and he looks like a kid with a trauma history, like out of utero trauma history. He hoards food, and does stuff like that too, just like a lot of our kids do. So sometimes for our kids, it's hard to tease out, was it from neglect? Or, you know, we also know that even if a mom is pregnant and not eating regularly and the fetus is kind of starving, then that can have an impact on them lifelong if they're in the womb starving all of the time. If we have a child or adolescent who can tell you what the rules are, but then they break the rule 2 minutes later and don't understand why they're in trouble, that's another neuro disconnect. That's not neurotypical and really common for our population. So an important thing to be aware of is that a lot of times right around ages 9 through 11, when our kids are in 4th through 6th grade or somewhere around there, is where we see a lot of them start to struggle more. And so there's a couple of reasons for that. Kids with FASD are super duper concrete thinkers. They don't get abstract concepts very well. And so, so a lot of times when you look at it, if you look at preschool and our K-12 education, it follows typical child brain development, right? We're not giving kids trigonometry when they're in kindergarten because we know that doesn't work for their brains yet. That part of their brain hasn't developed yet. And so, so what happens is a lot of our kids, because they're such concrete thinkers, can do somewhat okay academically in those early years of preschool and early elementary. But then by the time, and some of them are struggling all the time, right? Definitely, we've got those kids too. But a lot of them, all of a sudden in 4th grade, 5th grade, 6th grade, somewhere around there, it hits them at different stages. They can start to have bigger struggles and things happening. The reason is that starting in 4th grade, the curriculum is becoming more abstract, right? We're starting to give more tests out, like in a lot of decision-making tests, like multiple choice tests, things like that. And so trying to figure out the difference between A, B, C, and D, which is very minimal sometimes. It's just like one word or the name of somebody. And so for our kids who struggle with that kind of stuff and have working memory issues and have probably anxiety around tests, a lot of times they can't get to that information in their brain because they're feeling so anxious when they're taking tests. But they're also sitting there during class time and they're not comprehending what's being taught. Even though they're bright and have average IQs, their comprehension is often low and their working memory is low and all of these different kind of things, their auditory processing, all these other factors. So they're starting to sit in class and they're not comprehending stuff. And so what happens is their anxiety starts to increase. And I can tell you what, I told you I changed my major 3 times in college because I hated math. And I wanted out of math class. I mean, that's probably when I had to pee every day was during math class, right? And I wasn't a behaviorally challenging kid in the school system, thankfully, but boy, did I want out of math class and anything I could do to avoid math class because I had no idea what they were talking about. And who wants to feel stupid? Nobody likes to feel stupid, right? So to sit in those classes when you have no comprehension of what they're talking about, it's pretty hard. And other subjects too. Science is also usually hard for our kids. And so, so what's happening is a lot of them were doing somewhat okay in the, earlier elementary years, and now they're starting to struggle. And so their anxiety is increasing. So what we'll see, some of our kids will start blurting out more in the classroom. Will start eloping from the classroom. Doesn't mean getting married, just means won't stay where they're supposed to and are leaving the room. And they start acting outward. Some of them, they don't act out in school, but they bottle it up and save it for you guys at home, right? Isn't that sweet? That's actually called the delayed effect. And if you feel like a lunatic, I understand, because that was me. My daughter hardly ever raged in school and raged off the chains at home. Like, we had horrific evenings after school. for many, 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 many years. And so it's called the delayed effect. And there's multiple reasons. We don't have time to get into that today. But so, so those are the kids that are acting out externally. Some of our kids go internal and just become really quiet and withdrawn and start to struggle more kind of emotionally and with high anxiety and depressive symptoms that then can kind of preclude that. And so this is also, though, the end of elementary, early middle school is also when we see our kids becoming more socially isolated. And so, so most of our kids function at about half of their age developmentally. So if we're looking at a 10-year-old, they're functioning more closer to a 5-year-old. And for some, it's a year or two below or above that half-year mark. Well, when you're in kindergarten and first grade, everybody's kind of acting immature, right? But by the time you're 10, 11, 12, if you're acting half of your age, your peers don't want to be around you very much, right? The gap has widened between you and your peers socially now. And so a lot of our kids in the earlier years did have friends. And then by the end of elementary and early middle school, they struggle much more in maintaining some of those friendships. So this is also when their bodies are starting the pre-hormonal changes of puberty. So we have these kids at the end of elementary, beginning of middle school, who are really struggling, not understanding the academics, feeling socially isolated and lonely. This is when bullying picks up, and then their bodies are changing, and it's a nightmare, right? And all of you guys think about it, middle school, junior high, whatever it was called when you were there. Was that your favorite time of your childhood, right? Of your K-12, life? Probably not. When I do training in person, I'll say, who here middle school was there? Raise your hand if middle school, junior high was your favorite time of your life, before you graduated from high school. And like sometimes one random goofball will raise their hand and say they loved middle school. And I'm like, okay, that's odd. But usually it's nobody really had fun in that time. And so it's hard for neurotypical kids, right? And so it's going to be super hard for our kids with this type of neurodiversity. So we've got to do as much as we can to come around our kids when we start to see them starting to go downhill, because otherwise what we have is now all of a sudden we've got a pre-adolescent or an adolescent who has super negative self-talk and self-esteem issues and self-harming and suicidal ideation, and then school refusal, right? Then you get into the secondary schools and the kids sit there in the morning and they refuse to get up and go to school. And what do you do as a parent or a caregiver? You can threaten to take away cell phone, video game time, activities, whatever it is. And if they don't learn from consequences, it doesn't work. So you're screwed. It's like almost impossible to get these kids to school if they refuse. So we need to help prevent it getting to that point. And that's where we have to do some uber extreme advocacy with the school system to realize that adjustments need to be made so that they don't get to that point of hating school that much. I know that's easier said than done, I'll admit that, but with some different advocacy and tools, we can do it. It's important to know too, so some of our kids in their infancy and early childhood have the failure to thrive, are developmentally delayed for sure, but the majority of our kids are not and have really typical development. We've had our daughter, she's 22, we've had her since 5 weeks of age. She passed all the developmental milestones like she was supposed to, but also always had really unique, quirky, odd behaviors and things going on. Early intervention is crucial if we can. Diagnosis before the age of 6 is a protective factor in research. It's been shown to be a protective factor. The biggest reason for that is because it means that the families and the schools and the clinic support systems can change our approaches with these kids. If we have kids that have an FASD or likely have an FASD, using traditional parenting strategies and traditional educational strategies usually doesn't work very well. Choline supplements before the age of 5 can help repair some of the brain injury. There was research done here in Minnesota at the University of Minnesota, 10 years where they looked at kids. They had 2 to 3 year olds that they were giving choline is something that's in a lot of protein-based foods. If you just Google choline, you'll find it. It's in eggs, for example, but it's in a lot of beans and liver and a lot of things like that, meats and stuff. But it is there's a pill, they had a powdery thing they put in drinks, and it was more effective in the ages of 2 and 3 than it was for the 4 and 5 year olds, but it did have some effect also for the 4 and 5 year olds. Beyond that, they don't think it has that much of an impact, but choline is a natural thing you can just buy at the drugstore, right? So it's an easy thing, and not if you don't have a kid who will swallow pills or has issues with that, but you can also just look at choline rich diets. So the early intervention is crucial if we can do that. Again, a lot of times the kids aren't in our families till then. Diagnosis, I don't have enough time to get into the diagnostics of this. But when they do diagnostics, it's usually two providers. It's a medical provider, either a doctor, a physician's assistant, nurse practitioner who's been trained to specifically measure those facial features and all of that. They do the maternal alcohol history confirmation. If the kids don't have the facial features, you need to have the confirmation of exposure. And it can't just be verbally you saying, well, yes, birth mom told me she drank, or the social worker told me that. Usually has to be documented in writing. And then they also do neuropsych. So they take the neuropsych testing, they look at kind of these different brain domains to see if the child matches the profile. And then they use that the medical stuff, the facial features, and then the alcohol consumption history they combine that, and that's how they figure out the diagnostics for this. So this link right now, currently, I don't think works that I put on here. So again, NoFast just renamed themselves last week, FASD United, and they have a new website that they're doing. And currently the resource directory with the diagnostic clinics isn't on there. I have been told it will be eventually. So the best way to find a diagnostic clinic in your area is to try to connect with other parents who have done this and ask them where they've gone for it. Diagnosis is so important. It is not just a label. I get so sad hearing so many parents and caregivers around the country being like, I don't want them to have a label, blah, blah, blah. I'm like, well, first of all, these kids are already labeled, right? If they don't have the diagnosis, they usually get worse labels. They're juvenile delinquents. There's all these negative things that they're going to be labeled. And this diagnosis can sometimes help those systems or people who would be wanting to label them in a negative way, more labeling them with somebody who has a brain injury, right? That is a label, but it's a legitimate label, right? It's a helpful label. It can be. Getting the diagnosis can decrease feelings of anger and frustration within the family. For us, when our daughter wasn't diagnosed until she was 6. And holy cow, what a relief it was, because I felt like a lunatic parent. Nothing I was doing worked. It still took me years, even beyond diagnosis, to figure out how to parent her differently. But we were just feeling, my husband and I felt like big failures. Nothing seemed to work. And we were just like pulling our hair out. And so, the diagnosis can help with some of that stuff. It helps us change our expectations, and it is not lowering expectations. We've got to look at this differently, right? We've got to change our expectations based on each individual child, right? Not every kid should go to college in this world, right? And not every kid needs to be a star athlete, and not, we all have different paths and different journeys, and it's changing them based on each individual child's brain and personality and gifts and strengths and weaknesses, right? It also decreases some of the secondary problems that can result from the symptoms, right? If we don't get this diagnosis and if we don't start changing and doing things differently, our kids very likely will end up in the juvenile justice system and in some of these other things that we don't want them to get involved in. A lot of kids with FASD struggle with addiction because they have impulse control issues. And so we want to keep them out of that as much as possible. So, and then also what we want to do is we want to teach our kids, no matter what their age is, no matter if they're 3, 6, 9, 12, 17, we want to teach them about this diagnosis, about their brain, about its strengths, about its weaknesses, and about what they need to be successful, so that they can self-advocate for themselves, right? That's so, so important. If you are a family that maybe has contact with the first mom and could try to have the conversation with her about if she did use alcohol, it's a hard conversation, right? Or even if you're a caseworker or a social worker, right? Nobody likes asking awkward questions like that. It's not fun to be like, did you use alcohol when you're pregnant? Because it feels like a loaded question. But many women are just going to say no, and let's move on to the next question, right? Or get, their defenses are going to come up. But if we ask it a little differently and say, hey, is there any way before you knew you were pregnant that you had used alcohol? Because that's happened to so many of my friends and family, or, you know, just take the shame and the blame and the stigma off of it. Even if we think they drank after they knew they were pregnant, just ask it that way. We get much higher you know, admittance if we ask questions differently. I did this training actually for another group in Virginia in the spring, and on a Thursday evening, and by Friday morning when I woke up, I had an email from one of the parents who had gone through the training saying, thank you, Barb. I just had last night after we got off the training, I had the most enlightening conversation with my children's first mom that I've ever had. And she got the info that she needed. And so, again, this isn't always possible for a multitude of reasons, right? But if we just ask a little bit differently, it can help. And what we want to do is we want to smash the stigma. This is the most stigmatized disability or disorder out there in the entire world because we know what causes it. And we love to point the finger at the first moms or at the women who used alcohol when they were pregnant to blame them. And all that does is hurts our kids. All it does is hurt our kids. Try to get over the anger that you might have towards first moms, birth moms, whatever we want to call them, because I'll tell you what, no woman ever intentionally is hurting their child. They did not do this intentionally, right? It was either that they didn't know they were pregnant, they were struggling with addiction, or they had the misinformation that it was okay to drink. And so getting beyond that anger is a really important thing for all of us to do, because all that does is hurt our kids more, the more that we focus on that, right? You know, it's already done. We can't control what happened in the past. And if you don't struggle with addiction, it's something that it's really hard for those of us who don't struggle with addiction to understand that, right? So kind of move beyond that. So I don't have a lot of time today. I don't have enough time, but there's lots of other opportunities for you guys to get more information on this. Some of the common symptoms around this are impulse control issues, like issues with swearing, stealing, verbal and or physical aggression. Anxiety is a really common co-occurring disorder with these kids. They struggle with generalizing, right? If you teach them something in this situation and you want them to apply it to another one that isn't identical but is similar, that's an abstract thing. They struggle with that. Most of them struggle with understanding the feeling of the passage of time, right? We know we've got, I don't know, around 10 minutes, a little over 10 minutes left here or so. And most of us knows what 10 minutes feels like, right? We know what that feels like. We know what 5 hours feels like, or an 8-hour day feels like. And for many of our kids with this kind of neurodiversity, they don't understand how the feeling of time passed, how it feels. There's emotional dysregulation is a really, really common thing too. And so this is showing you an FASD developmental timeline for an 18-year-old. So they looked at research and they kind of made this hopeful picture of what many of our kids at 18 look like. At 18, most of them have the expressive language skills of a 20-year-old. This is why they're very confusing to you guys in your family systems or to the professionals, because they have such strong verbal expressive skills. Now, if you have a kid who has the lower functioning, that's not going to fit. But the majority of kids with an FASD have average IQs, sometimes low average, and even often high average. I have a lot of families I've worked with that have kids with IQs that are 120, 130 even. But yet there's something that doesn't make sense. They're not functioning like you would expect 100 IQ or 110, or whatever the IQ is, right? And that's because they have these strong expressive language skills, and that's why they appear more typical than and even more mature than their peers sometimes in just conversation, but yet they have the comprehension and the emotional maturity of a 6-year-old. Money and time concepts are at about 8, social skills are at about 7, and living skills 11. So if you take this developmental mixture that you see right here, right? If you take, that's called scattered development, right? Our kids have really scattered development. If you take that development, that picture of a kid at 18 who's graduating high school, and if we're going to expect them to go to university or community college or trade school or just go into the workforce, how are they going to do? Is this kind of a profile of somebody going to be very successful? Most of the time, no. And definitely we've got kids that are going to have higher numbers than this, and then kids with lowers, but this is just on average. So most of our kids are going to need several more years, many more years actually, of support into those young adult years. If it took heaven and earth to get them through high school, right? If it took a ton of family support, school support, accommodations on both sides to get them through high school, how do we think then that they're going to be successful in any of those things without a lot of support after 18? And so again, that's another reason why it's important that we're working with our kids and adolescents to understand this as well, so that they're not set up for failure. I see too many of our families where the kids are going off to maybe college or something and hit the wall and it doesn't work. And that now it's just another failed thing on their, on their, that hit their self-esteem. And then it's pretty hard to get them to try again. So again, the whole taking their age and cutting it in half, at 18, we're looking more at a 9-year-old. So are we going to send a 9-year-old off to college? Or are we going to have a 9-year-old take classes at the local community college without a lot of support? Probably not. They're going to need some more support. So there is hope. As I said, there's always hope with this, but for many of our kids, it takes more like into their late 20s and early 30s for them to start doing better. And I know that's exhausting if you're sitting there with a hard 10-year-old or 5-year-old or whatever it is, to think of that. That doesn't mean they always have to live within their family units. It just means that to set them up for success, we need to try to work within our communities to make sure that they have the right support in those young adult years as well. There's a lot of strengths that our kids have. I don't have enough time to go into all of the symptoms or the strengths even, but most of them are highly verbal, very kind, caring, huge sense of humor that many of them have, a lot of fun. But it's sometimes it's hard to see some of those strengths because we're so struggling with the challenging behaviors. But one common thing I do like to mention is a strength that's very common is that they're good with younger kids. And one of the things, though, that I recommend is if you know they have impulse control issues, that we should not leave them unsupervised around children. And they probably shouldn't be babysitting if they have impulse control issues. I've had way too many families get into sticky situations with that. So I like to say that quick. Symptoms of FASD can often look like willful disobedience, right? I'll have families all the time telling me how naughty and awful their child is, or adolescent, whatever it is. And it looks like willful disobedience, but really what we're dealing with is a brain injury and a child or adolescent who has a compromised brain. And so we've got to figure out strategies that are more effective with their brain, with the way that their brain was impacted. Many of you guys are probably parenting or caring for kids who have an FASD, but you might never be able to get the diagnosis, right? You might suspect it. You might in your heart of heart know that this is what you're dealing with, but because you can't get that confirmation of alcohol exposure, you can't get this diagnosis. More than likely, they're going to have some of those other diagnoses then of ADHD, oppositional defiant, whatever it is. Autism is a really common misdiagnosis. But start using the strategies and interventions for this. You can even talk with the school and say, hey, we highly suspect this, so look into this, use the strategies for this, even though it's not on their IEP or their 504. Hope starts with you guys, right? The changes that you can make as a parent or a caregiver to support these kids and adolescents, you will start to see hope return if you've lost it, right? And I was at a point many years ago where we had lost it. We were losing our mind in our family. It was such mass chaos all the time. It was a very toxic environment that we were living in. My daughter, who's 22, is one of the really extremely aggressive, physically and verbally aggressive kids out there. And so it was really, really hard stuff that we were dealing with. And it wasn't until I really started to get a deeper level understanding of her brain and of the anxiety and how all of it played together that we were able to start feeling more hope and being able to figure out how to parent her a little differently. Consequence-based parenting doesn't work. Right? I mean, I shouldn't say it doesn't work across the board. It might work a little bit, but overall, those kind of strategies, which is what almost all of us were raised with, right? The traditional parenting strategies of using consequences, usually doesn't work. And that's what can cause actual higher levels of chaos and trauma within a family unit. And that's what happened with us. We ended up having more extreme behaviors because we kept trying to use the parenting techniques we were parented with, and that's what the books told us to do and the professionals were telling us to do. And they were all giving us sticker charts. And I tell you, I started to get to the point where I was telling medical providers or mental health providers where to stick those sticker charts, right? Those are pretty ineffective for kids with an FASD. And so we've got to kind of, what happens is that typical parenting strategy of using consequences starts to impact the relationship between the parent and child, right? We're mad at them because they keep doing the same thing over and over and not learning from our consequences. They're mad at us because we keep taking away everything that they enjoy in life or whatever it is. And so, and it starts to just, and imagine, think, okay, it's really hard to parent these kids. Imagine being them. Oh my gosh, it breaks my heart when I think of the struggles that my daughter has had, the lost relationships, everybody's mad at her, constantly being in trouble in our family all the time back before we changed our strategies. I mean, it's a hard life, you guys. So what we need to move towards is more connected relational parenting, right? That is all about hope, connected relational parenting. If you haven't had much training or information on that, I don't have time today to get into that. We are going to be having a conference on December 8th, an all-day FASD virtual conference. We're going to talk about strategies in the afternoon that day. But I'll otherwise seek it out, find other ways to find this training. On our NACAC website, we do have some of that info on there and hope to have more of it in the next year too. We're working on redoing some things. But if you start using different type of approaches, you will start to see things going better. And what the thing you have to be prepared for is if you move away from consequences and you just start using more connected relational approaches, you're going to get judged by everybody you know, your friends, your family, your parents, the grandparents, everybody out there is going to be judging you and giving you really stupid advice, tons of stupid advice, right? And what I say is just listen, embrace it, just give them your little smile, right? Oh, thanks. Oh, your kids do this too. Okay, yeah, I get that, right? Just smile and then leave and find a parent support group where you can sit and vent about that, right? There's tons of support groups in the state of Virginia, a lot of great virtual support groups. And if you can connect with other parents who are parenting kids like this, that is going to be the most effective strategy out there for you. Learn from other parents, from their mistakes, from their successes, and be able to kind of share stories with them and vent together, and also share good positive things together, right? Support groups are not all about just griping and complaining. It's about coming out with hope and getting strategies. So find some support groups and connect with that kind of stuff. So here's just the info on save the date for our FASD all-day conference that we're going to have on December 8th. I'm still putting it together. It's going to be, open to anybody and everybody. It's great if you can come, that's great. Try to get your child's team to come too. Get grandparents, aunts, uncles, friends, PCAs, teachers, social workers. Share it with everybody, because we're going to have, the morning's going to focus on understanding the brain. Afternoon, we're going to have a panel of some young adults who have an FASD talking about what they need or what works for them. And then we're going to have a strategy session that myself and another parent are going to do after that. So please come to that. The best way to find info on that is to go and sign up for our NACAC, our e-newsletter. And I put the link on there. I'll be sending these handouts to Kate so that you guys can probably find them somewhere too, maybe hopefully wherever this recording is. Also, just a little bit more on our website, our NACAC website, there is a webinar that's on there. I think we also are a membership organization. I should have had a slide about that, but you can join and be a member of NACAC if you're a parent or a professional. I think that it ranges between $40 or $45 up to a couple of hundred for organizations. But we have like a quarterly news kind of journal that comes out with a lot of different strategies and information within the child welfare system from kind of experts from all over. And then also get a lot of other information. We have a national conference every summer. It'll be in July, and it's going to be virtual again this coming summer with phenomenal trainings at it. But we also were able to provide customized trainings, like this, only give me longer, right? I love having at least 4 hours when I want to talk about this, because then I can get deeper into the strategies. But someday, right? And someday I'm going to come back in person to Virginia. I can't wait for that to happen. But yeah, check us out. My email is there too. You can email me and I'll get you information on our conference when it's planned in December. So I'll hand it back to you, Kate.
Barb, thanks so much. As Barb told you, this is a primer. There is so much more information out there, and Barb has come to Virginia and done phenomenal training, and we do hope we get you back here soon, Barb. Couple of things that Barb mentioned was the organization for fetal alcohol syndrome. Excuse me, I used the old acronym, fetal alcohol spectrum disorder. Yeah. And you can still reach them at the old website, but the new one is FASDunited.org, and it is working. I checked that to make sure, Barb. Yep. And there is a Facebook group that is a national Facebook group for caregivers of children with FASD. It's called Parenting FASD Kids. It has over 7,000 members who are caregivers of children with FASD. So that is just pointing out some things that Barb had recommended for you. And I cannot recommend strongly enough your membership in the North American Council on Adoptable Children. The only reason I feel like I have resources for all of you is because we are an agency member of NACAC, and the value is far outweighs the price of membership in NACAC. And just this morning, I was on the phone with Denise Goodman, who always takes my call when I have a question, and we were talking about recruitment and retention. So please consider NACAC as a membership organization for you. As you all know, the Family Alliance membership here at JFS Richmond is free of charge, and that's so that you will have money to join membership organizations like NACAC and National Foster Parent Association and other organizations to get you your resources. So thank you very much, Barb. You're always so insightful and helpful, and we really appreciate you and NACAC. Thanks for joining us.
Thanks for having us. My pleasure.
Goodbye, everyone.